We start, though, with the COVID-19 situation here in South Korea. The country is forecast to see more than 400,000 new cases on Wednesday. That is a rather significant jump from the previous day's tally.
However, the country is seeing a gradual decline in infections, prompting authorities to consider easing the current social distancing rules. For more, our reporter Choi Min-jung is here in the studio with us. Good morning, Min-jung.
Good morning.
So what are we expecting for today? How many cases?
Well, we're seeing an increase in infections as usual as we get to the middle of the week. We will see cases in the 400,000s today. As from midnight to 9 p.m. Tuesday, South Korea saw over 414,000 infections. It's a jump of around 80,000 from the previous day. The figure has been increasing from the start of the week, but if you compare the tally to the same time last week, the number is down by around 61,000 cases. As authorities have said, it seems the country has entered the downward slope of the Omicron wave. A little more than half of the infections were confirmed in the capital region, with Gyeonggi-do province reporting the most with 116,000 cases and Seoul posting 80,000 cases.
And Min-jung, as Mok-yeon alluded to, South Korea is likely to revise its social distancing measures. Announcement expected on that on Friday and for them to take effect from next week. Do we know what we might be able to expect?
Well, officials appear to be considering relaxing the current social distancing measures. Currently, gatherings of up to 8 people are allowed and most businesses must close by 11 p.m. And this is set to last until this Sunday. So starting next week, new measures will be in place. The changes are likely to include expanding the social gathering cap to 10 people, and they're also likely to extend business hours to midnight. Authorities have said that now is the time to encourage people to make voluntary efforts rather than imposing strict measures. And they added that imposing strict restrictions is no longer effective at this point, given that the Omicron variant is much more transmissible than the Delta variant. They also said that imposing tougher measures is unnecessary when considering Omicron's low fertility rate, currently at less than 1%. Officials, though, are well aware that cases may spike if restrictions are all eased at once. And to avoid this, they reiterated that they have been gradually easing restrictions. The country's Pandemic Recovery Committee will meet on Thursday to discuss revisions, and authorities are scheduled to announce the new measures on Friday.
Now, Min-jung, these health authorities have also expanded the way COVID-19 patients recovering at home could be treated. Tell us more on that.
Right, Mok-yeon, now people with COVID-19 have more access to face-to-face treatment. Starting today, local clinics and hospitals, including clinics that practice Korean traditional medicine, can submit applications if they wish to treat COVID patients face-to-face. The treatment of outpatients has been mainly handled by medical centers specializing in respiratory diseases. But now, this will be expanded to other hospitals and clinics as well. Just like when people catch a cold, those infected with COVID-19 who wish to visit clinics and hospitals can see a doctor face-to-face after making a reservation. And this is allowed even if they are under quarantine. However, people must take note that any medication they need must be picked up by another person who doesn't have COVID-19. To prevent infections at clinics and hospitals, officials say they will have separate diagnosis times and areas for COVID patients.
And before we let you go, South Korea's health authorities are pretty concerned about the rising infection rate among older people here.
That's right, Mark. Currently, 1 in 5 infections are in people aged 60 and above. Last month, these seniors accounted for around 10% of the infections, but now the figure has increased close to 20%. Health authorities pointed out that seniors are becoming more vulnerable to infections because more than 3 months have passed since most of them got their booster shots, also meaning that the shot is not as effective in preventing infection as it used to be. Despite the waning efficacy, however, authorities have once again advised seniors who have gotten their boosters to get inoculated as soon as possible, saying that it's still 97% effective against developing severe symptoms.
So getting booster shots, it's even more important for people in the elderly and vulnerable age group. Thank you so much for your report, Min-jung. Talk to you again soon.
Thank you.